Hi, my name is Tara Gray and I am an occupational therapist working in a regional hospital in New South Wales. Currently, there are 55 million people around the world living with dementia. With this number estimated to triple by 2050, high quality dementia care is a global health priority. The unfamiliar hospital environment can be a strange and confusing place for any of us at times, let alone for a person living with dementia. As people age, senses such as vision and hearing can decline. It's a common form of dementia being Alzheimer's disease. Impairments of visual acuity, contrast perception, and colour discrimination beyond normal age-related visual changes are present due to changes in the retina and the optic nerve from the amyloid beta plaques. Spatial navigation is defined as being a complex cognitive function which is needed for a sense of safety, quality of life, and independence for older persons. Difficulties with spatial navigation can be an early predictor of dementia, and this ability will continue to decline during the progress of dementia. Wayfinding refers to the ability to move through an environment to find a targeted destination in a timely manner. For example, finding a toilet when you really need one. People living with dementia are more likely to have wayfinding difficulties in the unfamiliar clinical hospital environment. Humans form what we call cognitive maps in their brains to learn how to get about in a new environment. But for the person living with dementia, this ability can become impaired, which can be confounded when there are difficulties forming new memories. Wayfinding difficulties can lead to feelings of panic for people living with dementia, and therefore reliance on environmental cues for wayfinding increases. People living with dementia can also experience difficulties with stress tolerance and are subject to higher levels of external and internal stressors such as pain, environmental changes, cognitive changes, fatigue, and perceptual impairment. Just imagine how you would feel if you couldn't find the toilet and you're busting to go. It's not surprising that people living with dementia when in hospital have a double risk of falls, increased risk of agitation and anxiety, and an increased risk of life-threatening hospital-acquired complications such as fractures, intracranial injuries, and delirium. Today, I want to share with you simple, time-efficient and cost-effective additions we've made to our ward environment to make it more dementia-friendly, with the aim of encouraging you to do the same. We have also been inspired to make these changes due to the global move toward non-medication strategies to assist in the care of people living with dementia. The Psychotropic Medicines in Cognitive Disability or Impairment Clinical Care Standard, released in 2024, aims to encourage and increase non-pharmacological interventions for dementia care across Australia. The three main strategies I'm excited to show you today are visual enhancements to the ward environment to improve wayfinding and orientation, access to therapeutic aids such as robotic pets to reduce isolation and increase a sense of purpose and comfort, use of the communication aid Tree of Life, which I've talked about in another video, to increase the ability of hospital staff to lower hospital-acquired agitation by quickly understanding and addressing the unmet needs of people living with dementia. Environmental modifications can be cost-effective, simple, non-medication strategies to improve functioning for a person living with dementia. The use of visual and colour contrast can improve a person living with dementia's ability to see objects and features in their environment. Effective toilet signage improves continence, and in general, applying high colour contrasting visual environmental cues for wayfinding improves well-being for the person living with dementia. Displaying photographs or memorabilia outside the bedroom can increase room finding ability. Being in hospital can be a lonely, understimulating and socially isolating experience for anyone, let alone someone living with dementia. Appropriate and targeted use of dementia-friendly aids in the hospital environment such as robotic pets, plush pets, lifelike weighted baby dolls can all lower agitation a sense of social connection and increase a sense of purpose and comfort for people living with dementia while they're in hospital. The Tree of Life is visible at the bedside communication aid to help busy hospital staff meet the unmet needs of people living with dementia. So these strategies we have implemented are only just the tip of the iceberg, and as a hospital we are looking forward to putting in place more strategies such as contrasting mealtime implements and creating an outdoor space with access to nature, as interacting with and viewing nature can reduce stress and increase well-being for all of us. Brain areas associated with emotional responses such as empathy and altruism have been shown to have increased blood flow on functional magnetic resonance imaging for people viewing natural scenery. So thank you, and I wish you all the best with making these changes and more in your environment. For further information and ideas for improving your environment, feel free to go to Dementia Australia and Dementia Training Australia. We did.